Hi, I'm Erin with Body of Light Studio, and in today's video we're going to do one of my favorite series to alleviate neck tension and pain. So we're going to do some work to rotate and loosen up the rib cage, and also flex and soften, or flex and round the spine and soften the sternum. So you'll start lying down on your back, and you can either have your feet standing with your feet comfortably spread, hip socket distance maybe a little wider. You could also lengthen your legs if that's comfortable on your low back. And let's take a quick scan of the body, starting with the heels. Now, as we do this, we're not trying to change anything. This is purely for observation. So sense your heels on the ground. Notice where the weight rests on your right heel, your left heel. You might notice that it's more on the outside of one heel, more on the center of the other. Feel where your calves rest on the ground. Is one side heavier than the other, more grounded? Sense the negative space behind your knees. The right side, the left side. Traveling up your legs to your thighs. Feel how the thighs meet the ground. Is one side the right side, the left side, more completely in contact with the floor. Check in with your pelvis, how the weight is distributed across the pelvis, the right pelvic half, the left pelvic half, the sacrum. Sense your spine, starting from your tail, moving up through your sacrum, about 5 at the top of the sacrum, 4, 3, 2, 1 is at the bottom of the rib cage. Does your spine meet the floor, or is there space between the floor and your lumbar spine? Moving up your spine to T12, the bottom of the rib cage, 11, 10, 9, 8, sensing where your ribs and your spine touch the ground. And up into the cervical spine, your neck spine, your 7 cervical vertebrae. Visualizing the vertebra as you go, and feel the weight in your skull. Feel where your shoulders meet the ground, your upper arms, forearms, the hands. And you'll bend your knees. You can drag your feet towards you, knees bend wide out to the sides, and then place your feet standing, legs are parallel. Cross your right knee over your left knee, and as you inhale, you'll start to sway your knees over to the right, and then you exhale back to center. And that's the move. You're going to repeat that. You inhale, knees sway to the right, and you exhale back to center. You'll just keep going like that as I talk. If there's any pain, discomfort, as you do this, you make the movement smaller, and you move more slowly. And we're really trying to be easeful as we do this. You want it to be like 20% effort. We don't care how close the knees get to the ground. You're paying attention to how you're moving, feeling the weight transfer from your heel into the instep of your left foot, across the pelvis into the back of the right hip. And you're observing the rotation. So as your knees twist to the right, your pelvis gets dragged along. How far up your spine can you sense this rotation? Notice the effects of the rotation on your sternum. And maybe it translates all the way up into your skull. Complete your last movement. Uncross your legs and lengthen your legs, or keep your feet standing if that's more comfortable on your back. And just take a moment here to sense the difference between the two sides of the body now that you've done the move on one side. You might feel longer on one side, more grounded on one side. And then again, you'll bend your knees. Knees can widen out to the sides as you drag your feet into standing, and you'll cross your left knee over your right knee. And you'll inhale, the knees sway to the left, and exhale back to center. Moving slower than you think you should, or slower than you want to, moving as slowly as possible. It doesn't matter how many of these you complete. What's important is the quality of the movement and your attention to the movement. Is there anywhere you can release your spine more completely? Your shoulders, your neck, your skull? And as the knees twist to the left, feel how that might drag the sternum downward in the direction of the knees. Maybe the chin drags downward in the direction of the knees. Be really soft and gentle, slow, gentle movements. You'll do one more, and then we'll rest. You'll uncross your knees. Feet can stay standing, or you lengthen the legs. And again, check in. Is there more of you now coming into contact with the ground? Maybe your ribs are a little heavier into the ground. Maybe your spine is releasing more completely. The muscles of the legs releasing so that the femurs can drop. And again, you'll bend your knees, drag them wide, feet standing. And this time you're going to interlace your hands behind your head. Pay attention to which pointer finger is on top, because we'll try to switch it next time. I've got my left pointer finger on top. Elbows rest wide. Now this one's a hard one because we want this to be easeful. We're going to do a sit-up, but it's not about doing a crunch for the purpose of toning our abdomen. We're trying to be really soft and gentle, make the movements small so that we can flex the spine. Flexing meaning coming into the sit-up position. So you'll take an inhale, let your elbows rest wide, and on your exhale, narrow the elbows, gather the shoulder blades onto the rib cage, and use your hands to lift your head. So notice, we're not trying to lift very high. We could like pull on our neck and really flex in the cervical spine. We do that already every day, all day. So let the head be heavy, and you're gonna round the spine gently from the tail all the way up to the crown of the head. You'll inhale, release down. And on your exhale, the elbows narrow, the sternum melts, folds in to the spine, and you round. We'll do just a few more of those. Try to do like 80% less work. Make the movement slow, soft, and small. Most important thing is that the head is really heavy as you do this. Second most important thing is that the sternum is melting, folding in. The ribs are folding at the front and opening at the back. Let's just do two more. Inhaling, elbows open, you completely rest. Exhale, elbows narrow, the head falls back into the hands as you float the head up. Inhale to release, soft jaw, eyes heavy. Exhale, use your hands to fold the spine. Lower the head, release the arms by your sides, and again lengthen your legs. Observe. Feel the spaciousness across the cervical vertebra, especially at the base of the skull. Maybe there's some newfound length at the back of the neck. Feel how the shoulders and the ribs meet the ground. And you'll bend your knees, drag your feet to stand. Interlace your hands behind your head. Switch the interlacing if you can remember which side you did last time, and cross your right knee over your left knee. Gently sway the knees to the right. You're going to leave them here, so if it's painful anywhere, if you feel a tug in the sacrum or the hip, maybe don't take your knees so far over to the right. You'll take an inhale. Exhale, elbows slightly narrow, head stays heavy, and you fold the sternum, roll the ribs back. Inhale, release your head, elbows open. Exhale, flexing the spine to float the head up. So the back of the spine is lengthening and the front of the spine is shortening. Do less work in your cervical spine and your neck spine. Can you be any softer in the heart and the sternum as you fold? Inhale, head releases down, arms open. Exhale, elbows fold in, head heavy as you float up. And then you'll come back to center with the knees, release the hands down by your sides, uncross your legs, and once again, lengthen the legs. Check in with your right half, your left half, observing any difference in the sense of groundedness or length. Maybe you feel more connected on one side. And we'll do the other side. Bend your knees wide, drag your feet to stand. You'll interlace your hands, once again switching the crossing. And cross your left knee over your right knee. Sway the knees to the left, leave them there. Inhale. Exhale, elbows fold in gently, head heavy, and you soften the sternum, float the head up. Inhale to release, and exhale to lift. You're trying to lift like straight up towards your right hip or up towards the ceiling rather than twisting to your left knee as you do your sit-up. Exhaling, feeling the ribs deflate, lungs deflate, and soften as you exhale. See if you can go even more slowly, even less effort. Lift like 5% of however high you could lift if you were actually trying to do a sit-up or a crunch. Keeping your tongue resting at the roof of your mouth. You can have your eyes closed or your gaze wide and soft. Let's do one more. Sway the knees back to center, uncross your legs, rest your hands down by your sides, and lengthen your legs. Feel the hollow space inside your pelvis, between the aces, your hip points. Check in with your spine. Is there more of your spine coming into contact with the ground? You'll bend your knees wide, drag your feet to stand. Now this time you're going to cross your right arm over your left. So I'm going to be holding, I'll sit up and do this just so you can see, but I'm holding kind of like the outer shoulders, right arm crossed on top of left. Close your eyes and you're just going to rock your ribs side to side. So your elbows will sway side to side. Whatever your head does, let it happen. And now make the movement small and slow and smooth. Are there any like bumpy parts of this rocking motion that you could smooth out if you were to move a little more slowly and smaller? I like to use my left hand to help me rock to the left, and my right hand pulls on the left side of the shoulder girdle to rock to the right. So left hand pulls the shoulders to rock you to the left, and right hand pulls the shoulders to rock you to the right. Now keep your gaze up at the ceiling. So you're going to open your eyes, look at the ceiling, and continue to rock. So your head isn't really moving, it might move a little bit, but your gaze is centered. Now allow your head to turn with your shoulder movement, and you want the head and the shoulders to move evenly. So if your head is able to go farther than your shoulders, you're going to make your head turn just a little bit less, and vice versa. Now turn your head opposite the shoulders. As your elbows go to the right, your head will go to the left. You're going to gaze to the left, and head turns right, gaze turns right, elbows rock to the left. And you'll keep going like that. Now this can start to get a little bit tricky as we involve the gaze. Again, if there's any pain, discomfort, or if your brain is getting confused by the movements, you make the movement slower and smaller, smoothing out the movement. And then let your head rest at center, uncross your arms, lengthen your arms by your sides and lengthen your legs. Sense your rib cage. Sense your sternum. The weight in the right half of the occipital bone at the bottom back of the skull and the left. And you'll bend your knees, drag your feet to stand. You'll cross your arms with your left arm on top. We'll do the same thing. You'll rock side to side. Let the head do whatever. And close the eyes. It's a little bit easier to relinquish control of the head with the eyes closed. Smoothing out the movement. Maybe you're getting better at this. Maybe your ribs are starting to loosen up and your spine is getting more rotation in the upper spine, the thoracic spine. And you might be able to make this a little bit bigger and still be smooth. If not, you stay small and slow to smooth out any bumps along the way. And now look at the ceiling. Your eyes are open. Continue to rock. Your gaze stays up at the ceiling. Now turn your head in the direction of your elbows. So you're rocking your head to the same direction as your ribcage is twisting. Now you'll do your head opposite, head left, shoulders to the right, head right, shoulders to the left, smoothing out any bumps. You're not straining in the neck. We don't care how far you turn your head. Keep the movement easeful. All right, now here's where it gets tricky. You're going to keep your elbows, your shoulder girdle turned to the left. Your head is turned to the right. Your eyeballs are going to look to the left. And then you switch. So now your shoulders, elbows are turning to the right. Your head is turning to the left. Your eyes are looking out at the right corners of your sockets and you're looking to the right. And then you switch. So now your eyeballs are looking in the same direction as your elbows, but your head is turned opposite. And switch, and now you're going to keep going like that. And this can get really tricky and confusing for the brain. So you can smooth out the movement. Stop when you get confused. Eyes travel the same direction as the elbows. Head travels opposite. And rest, hands by your sides. And lengthen your legs. All right, one more time like that. Bend your knees, feet standing, cross your right arm over your left arm, and you'll rock side to side, head does whatever. Make the movements really big. Let your pelvis be soft. But you're not trying to hold your pelvis in place, but your pelvis and your knees are relatively still. Your knees are not swaying side to side. Big rocking movements here. And now make the movements really small, jiggle yourself. I have to close my eyes for this one. Otherwise my head wants to hold my body tense. So with my eyes closed, I'm jiggle, 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 jiggle. And it's hard for me to not do this from my pelvis. I want to jiggle from my hips, but instead you want to jiggle from your shoulders. Like jello. This one actually gets really confusing for me. And then again, big swinging pendulum movements. And rest, hands by your sides, lengthen your legs. Feel your breath. You might have more freedom in the diaphragm and ribs after all that rocking. All right, you'll bend your knees, place your feet standing. Let's do one more movement in this series. We'll go back to that first movement. You'll just let your knees sway to the right, take an inhale, and exhale back to center. And observe the difference from the beginning of the video until now. And just switch sides. You may feel more movement in the sternum, more movement translating all the way up into the skull as you do this. And uncross your legs, feet can remain standing, but you can lengthen your legs. Take a moment to check in with your tailbone, your sacrum, travel up your spine. Notice if there's more of you meeting the ground than there was at the beginning. And you'll bend your knees, place your feet standing, roll over to your side, sit up, and stand up. See me, but take a moment standing and sense your feet on the ground. Feel the weight pouring down from your pelvis through your legs into your feet. Notice your gaze. Does it feel any different? I always feel so much taller, almost like a giant. The floor is really far away from me after I do this series. And take a walk around. And that's it for today. Thank you for joining. Hope to see you soon. Bye.